Hello, this is Dr. Oki. I'm going to cover what you need to review for your quiz 2. Make sure that you understand all the abortion types. There's threatened, inevitable, complete, and missed. Just make sure that you understand and review the presentations of each type. Bleeding complications in the second trimester. So we discussed these conditions, placenta previa. What is a patient going to present with? What's the typical presentation? What are the risk factors, clinical signs and symptoms, management, mode and timing of delivery? Placental abruption, also known as abruptio placenta. The patient presentation, risk factors, clinical signs and symptoms, management. And what would you expect to see on the fetal monitor? What kind of contraction pattern? Make sure that you're reviewing the fetal monitoring lecture in detail. Make sure that you're able to differentiate between placenta previa and placental abruption. Incompetent cervix, when does it occur? Symptoms a patient may present with, and review expected findings in a patient with a molar pregnancy. Polyhydramnios and oligohydramnios. Remember, these two are the opposite. Poly is too much fluid, oligo is not enough fluid. So know the potential causes of each of these conditions, fluid levels of each in terms of mLs. How might we diagnose it? Make sure that you understand pre-existing medical conditions. I want you to especially focus on cardiac patients, patients with cardiac disease conditions, and understand the important education of patients with a history of asthma. And focus a lot on medications, the importance that they want to continue those medications even during pregnancy. Preterm labor. Know the gestational age that constitutes preterm labor. How is it different from full-term labor? How does a patient typically present? Management and workup for a patient in preterm labor, and what constitutes preterm labor. So how do we know a patient is not just having preterm contractions, but they're experiencing preterm labor? Make sure that you read and understand about blood incompatibilities. What do we give RhoGAM for? What's the purpose? When does this patient need it? And the timing that it's given during pregnancy and after delivery. And that's all. If you guys have any questions, please email me in Canvas. Thank you.